We're just about 15 minutes now past the hour of 5 o'clock, and that means it's time for us to start our new timing for our program here, Vision Talk. So we're glad to have two lovely ladies in the house with us today. We're talking about the importance of regular eye checks, and along with the rehab specialist Teresa McMorty, joining us today is optometrist Tia Crockwell. So we'd like to welcome you ladies to the studio. Welcome, welcome.
Thank you.
Good to have you here. Just a little background on Miss Tia, because she is the founder and optometrist of OnSight Optometry here in Bermuda. She pursued her biomedical sciences at the University of Brighton before venturing into optometry at Aston University, first-class honors at both institutions. Inspired by her lifelong experience with glasses, I'm sitting here looking at her beautiful glasses on her beautiful face right now. After wearing them since the age of 2, she understands the importance of regular and exceptional eye care. And beginning her professional journey as a summer student with Bermuda Vision Care, we're all very familiar with Dr. Anthony Cease here on the island, and with the guidance of Juanita Smith there. You're now, with that foundational experience and some experience overseas, here you are now with your very own optometry business here on the island. So we're excited. Tia, welcome.
Thank you for having us.
Good to have you here. Always a good time, Teresa. This is nice to have such a wonderful sight specialist joining us today, and we want to talk about, I guess, the importance of regular eye checks. That's what we're going to start with, Tia. Maybe you might want to talk a little bit more about your journey, and the fact that here you are, joining the ranks of several well-known Bermudian optometrists here on the island, and doing the great service that you do.
Okay. So I've been in Bermuda for about 3 years now practicing optometry. And just recently launched OnSight Optometry, where we do mobile eye exams. So we come to patients' houses and offices, and meet them where they're at and make sure that their eyes are healthy, and we can do it all on site.
Wow. So that's huge, I know, for some folk who perhaps either have mobility issues or even sight issues. It's nice to have someone come to you, and you're the only, I would think, mobile optometrist. And what does that involve with the testing that you have to do, and having to have equipment be mobile, I guess, and stuff like that?
So it's super duper convenient for the patient.
Sure.
Super duper inconvenient for me, but but the patient matters most. So I have most of the equipment that you would get in a traditional optometry practice. It all fits in the trunk of my car, and I can set up in the house or the office.
Got you.
And it takes about the same amount of time that it would in a traditional practice.
And are you doing the ones we're sort of used to, where you dilate the pupil and they might look all over at your retina, and then they do the little puff test, and then they do the pressure test, and the visual field tests? I think I'm ticking all the boxes there about the things that happen.
So we don't do the visual field machine,
okay,
but we can check your visual fields in other ways.
Oh, absolutely.
We check the vision. We check the need for glasses or contact lenses. We can order the glasses. We check the pressure, which is the glaucoma screening, dilate the eyes, look at the retina, and check for other health issues like diabetes or macular degeneration, and lots of different eye diseases, as well as systemic diseases.
Got you.
I think that's what we're going to focus on tonight.
Got you, yeah. So, but we'll talk about, eye health in general, but did you find that there was a need, because you did work, in a couple offices here on the island, and you had some experience working locally here in brick and mortar establishments, but this need for people to have service come to the homes, you found was something you're like, I'm going to jump on that and make that a real thing.
Unfortunately, some of my patients weren't able to come back for their yearly checkups, and then they were left with glasses that were no longer useful for them.
Got you.
And their husband or someone would have to come in and beg, can you renew this? She can kind of see, and it just didn't feel right to issue
have
the
them
wrong
spend the money and perhaps it not help them as much as they could.
So I thought, how can we get this to the people? And that's how it was born.
Got you. That's awesome.
And
Now,
don't you just love the name OnSight?
on site, yeah, she's coming to see you on site.
really clever.
It's very, very clever.
Sight on sight.
Sight on site. Maybe just talk a little bit, if you don't mind, about your personal struggles with your own sight. And you said from a 2-year-old, it's tough for little ones to wear glasses.
Yeah.
But I just saw, you see those amazing videos of where they have a child either
Yeah.
hear or see properly for the first time, like little babies, and the huge smiles and everything like that. Was that something similar to what you went through, where you struggled as a baby and then your folks figured it out? Or
No, so they noticed that one of my eyes wasn't a lot. They weren't.
got you.
straight.
So a muscle problem,
Yeah.
eye muscle problem. Yeah.
So once I went, the Bermudian optometrist who they visited didn't see much of an issue.
Got you.
And they ended up taking me to Boston. And they prescribed the glasses for a lazy eye.
Got you.
And luckily now both of my eyes can see perfectly through
Yes.
my glasses. But things like that, it's really important to pay attention, because you can miss little things with
Sure,
children.
with
they
kids,
don't,
yeah.
They just think that
Everybody
what they
sees
see-
like
yeah,
that. Exactly. And with strabismus issues,
Yeah.
because I've had them too from thyroid eye disease. So I understand what you're talking about. And a bunch of folk with lazy eye have the either left or right issue. Mine was the up and down one, and that can happen as
Yeah.
well with kids with lazy eye as well. And gosh, we've, these are great services here on the island to get that dealt with. So people, I think, have to be their own best advocate and have to say, yes,
Exactly.
there's this and this, and ask for this and this. And now
Yeah.
you have someone who's sympathetic to something
Yeah.
like that. How often do you think that happens with little ones in the whole lazy eye thing, or or have you
I think
noticed
it-
in your practice maybe?
Yeah, I think it depends on the parents and the teachers, how
Got
much
you.
they're actually paying attention.
On point and,
Yeah.
and making sure something is
And that's
said.
why it's really important to just go for regular eye test as a child, because if you don't know what you're looking for as a parent, then at least the optometrist knows what they're looking for. And we check their vision, we check their muscles, we check all of that, so that you don't have to be caught out.
Yep.
And one eye can become lazy if it's left untreated,
Sure. Yeah.
and stay lazy.
Yeah.
And after about 12 years old, there's nothing really that we can do about it.
Yeah, and
So-
not that would invasive things have to happen if you don't do something ahead of time. So how often do you think for young children is necessary for regular? Is it an annual thing like we talk about, when you
Yeah.
go to your GP, just an annual thing? And is there different, of course, if something is discovered, then more follow-up, more
Yeah,
regular
more
follow-up
regular.
needs to be done, right? What about with teenagers? Are there things that manifest themselves perhaps later that need to be taken care of, Teresa?
Yes, absolutely. My experience with teenagers is one of the main eye conditions with teenagers is retinitis pigmentosa, which is pinhole vision.
Got you.
And which is where you lose your peripheral vision, and that can manifest itself in adolescence.
In adolescence, as opposed to younger children, is it more
Yes.
common in the adolescent?
Well, with younger children, from my understanding, remember, and I'm not a doctor, but from my understanding and my experience, from if you're born premature
Okay.
and you have to go into an incubator, this was more prevalent years ago, but
Gotcha.
there could be too much oxygen put into the incubator, and that would cause damage to the
Oftentimes in incubators, in preemies and stuff, you'll see them with eye protection on as well, I think perhaps as to mitigate things like that being an issue later in
maybe,
life
yes.
perhaps. But yeah.
so that's where so they have pinhole vision, and you can be born, well, not when I say born with that, you can have that from that age,
Sure.
but you can also, if it's hereditary, you can also show itself in adolescence. For
Gotcha.
some reason, that's when it develops. Mostly, I'm not saying that's the only time, but mostly from adolescence onwards. So again, if a teen doesn't really realise that their peripheral vision is
Shrinking.
is shrinking.
Yeah.
So it's really important to continue having your eyes tested all that time. Yeah. All the way through life, I think it's really important all the way through life, because things can change, with different medications and.
Okay, so if these something like retinitis pigmentosa is caught or paid attention to early, Are there ways to slow it down, or ways to arrest it necessarily?
No, but there's ways. Well, not that I understand.
Sure.
I might be completely wrong with that. But by having that under, that
having
knowing
it diagnosed,
and understanding a diagnosis, are in adolescents in particular, they find that very hard to cope with. The young ones that I've worked with in the past have found that really hard to come to terms with. 1 minute they were skateboarding fine, and then the next minute they they can't do it.
They can't see
and
well
so
enough.
learning new skills, and that's difficult because of the peer pressure.
Uh-huh.
So all the help that I can give to adults with technology and the long cane and all the wonderful things that I can teach, a teenager really doesn't want to be any different.
Sure,
and
it's tougher.
so that's a completely different ball game.
Uh-huh.
And so they won't always even say that they're having trouble if they're noticing trouble with their sight, because they don't want to.
Now, something like that, Tia, to diagnose something like that, is that sort of a field of vision test that needs to be done to diagnose something like that, or when can you see it in the back of the retina if you're doing one of those retina exams?
Signs, and I think that's also the really important thing about annual eye tests.
Sure.
With that, unfortunately, there's not much that you can do, but there are so many eye health conditions that you can catch early, and then make sure that you're on the right track so that it doesn't get progressively worse.
Yeah, we've talked about diabetic retinopathy and glaucoma here as well. What in your practice, what do you see as far as those two eye issues?
Yeah,
and the prevalence maybe of them here on the island?
So they are hugely prevalent on the island. And that is so important to catch early. So you can come in for an eye test and think that you're just doing, the looking at the letters, and maybe you'll need glasses, maybe you won't. But we also check the pressure.
Sure.
We can see that, okay, the pressure's a bit high, but your optic nerve at the back of the eye is still healthy.
Sure.
So now that you've come early, your pressure's just a little bit high, we can refer to the ophthalmologist. They can lower the pressure and make sure that the optic nerve stays healthy and it doesn't actually progress to glaucoma.
Sure.
And then with diabetes, someone might just come in because they need their license renewed, or more importantly, it should be for their annual check. But they could just come in and not even think that they have diabetes, and we can see signs in the back of the eye, looking at the small vessels in the back, and actually say, you need to follow up with your GP, get some blood tests,
your sugar under control,
because something's not right.
Something's not right now, and with diabetic retinopathy, they lose sight because the retina becomes damaged. Is that what happens with that?
So the uncontrolled sugar will affect the small vessels at the back of the eye, and they become a bit leaky, and you get little bleeds at the back of the eye, which ultimately will affect your vision.
Sure. So the surface that your brain uses to see with becomes either cloudy or dark spots, and all of that.
But it's good if you can catch it early. Most times you can fix it with just like your diet and your exercise and your medication, as opposed to if it's too late and you might need laser treatment, and that affects your vision as well.
Sure. Yeah. All of the other sort of let's try and fix it now options are not nearly as effective as let's try and prevent it ones, right?
Be proactive.
To be proactive. So, prevention, eye protection, I guess, Tia, is the thing. I mean, how do you feel about, we live in, so much sun and reflection and UV rays and all of that. How are we here as far as eye we could be better, I guess, is what you're going to tell me as far as prevention and eye protection.
You can see so much in the back of your eye that gives an insight into your overall health.
Your overall health, yeah.
So you can prevent some health conditions by just getting your eyes
Getting your
tested.
eye exam. I think we've mentioned that before. The retina is the only place where you can see inside blood vessels without cutting something open.
Correct.
So having an optometrist like Tia be a part of your annual health checkup is just as important as, any other sort of primary health screening you could get, because it makes the difference. The pre-diabetes, the pre-high blood pressure.
You can see signs of blood pressure issues, high cholesterol, thyroid disease.
All of that can be looked at.
Yeah.
with the eye. So
Could
once
I just
again,
ask
sure.
you a question?
Yes.
Actually, just come to mind. I'm under the understanding that to protect your cataracts, you wear sunglasses and a hat when you're out, and particularly over water. Is that right, or is that just a myth?
To slow down the progression of cataracts, you want to have as little UV rays coming in as possible.
Right.
So
Got you.
wearing your sunglasses and having a
Shade.
hat will slow down the progression of the cataracts.
Okay.
But people, everyone does develop cataracts at some point
Sure.
in their life.
Most folk, yeah, and
Yeah.
the treatment of them now. I mean, I was witness a few years ago, pre-COVID, to see some great ophthalmologist medical conventions here on the island, and see some of the. There really is amazing things that can be done. I've had so many people be fearful about getting their cataracts taken care of here. Maybe you can talk a little bit about. I mean, yes, any surgery is just that. But just how the technology has advanced so much now with the correction of cataracts, with clearing them and fixing lenses and stuff. Maybe you can speak a little bit about that, Tia.
Yeah. So I'm an optometrist. I don't actually
You don't do the
operate
surgery,
on,
yeah.
on your eye, but we have great ophthalmologists in Bermuda.
We do, yeah.
It's you oftentimes have no reason to travel overseas.
Sure.
The Bermuda optometrist
Sure.
do a great job.
Uh-huh.
The actual procedure, I believe, is no longer than like 10 minutes. Like
For sure, it's that quick.
It's not
Yeah.
a big procedure, and it's one of the most common
Yeah.
surgeries that's performed in the world.
Anyway,
So
yeah,
they
cataract
should,
surgery is
yeah.
done more often
Yeah.
than anything else.
they should be used to it. It's really tiny tools, so
Sure.
it's no big knife coming at you. It's
Sure.
really tiny.
Tiny.
Someone holds your hand and talks to you the whole time.
Yeah, you don't even need anesthesia. They do. They
Well, you
numb
get
the
some
eye.
local,
They
yeah.
numb the eye. Yeah,
And then you can leave that same day. You don't have to walk out with an eye patch.
Sure.
So it's not as scary as a lot of people think.
You hear that, listeners out there? We're really talking to
Go
all of
get
you
your
right
cataracts
now who won't drive. Those who won't drive at night now, because
Yeah.
that's worse. The reflection
Yeah.
when you're trying
Glare.
to drive at night when glare makes cataracts very obvious for folks. I know that for a fact from family members. So yeah, we just want to really encourage that. Come and see Tia, then she'll refer you to a great optometrist, and you can get them
Ophthalmologist,
fixed.
yeah.
A great ophthalmologist, yeah, to do the actual surgery. So, what has been your experience working with Vision Bermuda, Tia? As you've come to know Teresa now, and
Yeah.
we're all good friends. We're going to talk about this every month. So,
Vision Bermuda is a great resource for Bermudians. It's lovely that we have it. And Teresa works mostly, I shouldn't speak, you all know her, but with the low vision. So sometimes if the glasses aren't doing enough, then Teresa can come and help you. And it's a nice relationship because I can do the things that she can, and she can do the things that I can.
Yeah.
there
So,
you go.
Yeah.
Yeah,
Do
and
you
we're
wanna
both
add?
visiting, clients' homes now, so that's great. And we've already worked together with one of my clients. I can't really say any more, of course, because of confidentiality,
Sure.
but that's worked really well. So, I don't really know what to say about that. We've got a couple of ideas,
Yeah.
haven't we? But we haven't got them sort of off the ground yet. So,
Got you.
Exactly.
so
It's
once
going to
we
be
have-
lots coming up, I'm
Yeah.
sure.
Lots coming up
Yeah.
with
Yeah.
I think Beacon House is probably just weeks away.
Well, they
From-
broke ground today.
Yes.
Outside. I don't know
They-
whether you've noticed, but yes, I'm very excited about that. Yeah, so, because we're having a training area and a patio and everything
Sure.
done, and from the traffic lights, we're having proper, paving that people can, tactile paving is the word I'm looking for.
Sure.
Going up into Beacon House, and it's now painted inside, and the flooring's mostly down. So yes, we are. All of a sudden, we're getting there, but I don't want to give a date.
We're not
because-
giving a date because
No,
we don't
no,
want to miss
that
it.
doesn't work. That seems to jinx it.
But
so,
boy, oh boy, are we going to talk about it when it actually
Oh
happens?
yes, it's going to be a whole vision talk just on Beacon House for sure. or yes, so it's very exciting. I was really, really happy to hear that they've broken ground today to start making, because all the long grass and everything, poor Beacon House, it's been looking so sad for such a long time.
It's been a construction site, you know,
Yes.
and that's understandable, and the setbacks that happened and stuff. But now, with it, we can taste it. It's that close to coming to fruition, and we're really pleased about that. So, looking ahead to that, what's that going to do? I know there. Should we mention that the off-site stuff that is still available again to folks out there? Is Phyllis still doing anything off-site?
Yes, Phyllis is still doing the IT classes
Okay.
on a Tuesday and Thursday morning, but she's having a rest over August. I don't mean she's having a rest.
She's off
breaking
for the summer
holiday
break.
period.
Yeah. Uh-huh.
Yes. And we've got some. Phyllis also organises some meet and greets. You know, with Digicel, which are very helpful and still providing us with their, and of course the Adult Education Centre for Phyllis's classes.
For the space to do them,
Yeah,
yes.
for her to do the classes. And I'm meeting and seeing clients within their homes doing a lot of mobility. It's incredible how many mobility, using the long cane, you
Sure.
know, that I have been teaching, and how people have just
It's
blossomed.
changing their lives, because it's about
Absolutely.
building confidence for them, not
Yeah.
to hurt themselves, which is the general, you know, that's what we're trying to have happen here, dealing with low vision and the loss of vision the way that you do. So that's good news. Do you think that, you know, Vision Bermuda and the hard work that you did and the folks before you have made dealing with vision loss here not the horrible, big, scary thing that it has been in the past?
I think
you know?
the scariest thing is not being in touch with us.
Gotcha. Yeah.
So when people are thinking, oh, should I, you know, should I ring, shouldn't I? Oh, no, I'm not ready. Oh, no, I don't need vision
Sure.
rehab. And then they come and join us, and I do an assessment, first of all, and I do low vision assessments as well, which is magnification, lighting, glare, and you're talking about cataracts and driving at night.
Sure.
I have a range of glasses, different shades that could help with that. But so long as you're able to drive at night and
Sure.
the cataracts aren't too dense that you can't see properly to
Sure.
drive,
Yes.
then I can help with that.
Wow, that's good to know. There might be folk out there that have
yeah.
totally avoid going out after a certain time for fear of being uncomfortable on the drive home.
Yeah.
So, but just the right, I guess, filter of
Yes.
glasses over their regular prescription can help with
Make
that.
sure you have an up-to-date prescription.
An up-to-date prescription,
And then
as
you
we
can
spoke
put the
of.
filters
Yeah.
on top.
The glasses will fit. Yeah,
Sure.
yes, exactly.
Yeah.
The filters go on top of the glasses. I call them glasses because that's what I used to call them in the UK. So,
Sure.
yeah, they are filters to go over the top. But I'm very excited because we're having a low vision clinic. I'm trying to put together. I am putting together a low vision clinic in Beacon House. So we will run that monthly to begin with.
Okay.
And I'm hoping that Tia will come along and support with that as well. And I'll have all the magnification, lighting, all of that. And I've got a lot of the glasses in at the moment, but I just can't, the filters,
Sure.
I just can't take them to everybody because my car's only
Yeah.
small and there's that amount that you can,
Gotcha.
you know, how much
That
you
you
can carry.
can carry
So
around with you.
I
Yeah.
get it. Yeah.
Yeah.
Uh-huh.
So you get it. Yeah. So once we're open,
Uh-huh.
then that'll be much easier. You'll be able to make an appointment with
Come
me
on in.
and come
Yeah,
on in.
get what you
and
need.
Yes, so electronic equipment as well.
Uh-huh.
Electronic magnification. Yeah.
So it's good that I can reach some of the people that Vision Bermuda hasn't reached yet,
Uh-huh.
and advise them of the services that are available. And same with Teresa, she will
Yeah.
see who would benefit most from my mobile services as well. So
Absolutely.
it provides that convenience
Uh-huh.
to patients who might have just given up.
Uh-huh.
Yes.
Now, Tia, being a local girl,
Yeah.
I'm sure you found, not that we haven't had other local doctors, but being a local girl, maybe the trust issues, and things like that, especially with older folk, they might be like, well, who's your mama, and stuff like that. And that really makes a difference when it comes
Yeah.
to, okay, I can trust her.
I save
that
it to
she's-
the end.
Yeah.
Because they ask in the beginning, I'm like, well, what if you don't like my daddy? I'm not
Yeah,
telling
yeah,
you.
which Crockwell are you and stuff
Right.
like that, right? I'm sure that happens here in
Well,
Bermuda.
I'm married to a Crockwell.
You're
so
married
that
to a
helps,
Crockwell, so
actually.
there you go. You can claim a little separation
Yeah.
if that's an issue. Too funny. Shout out to your husband, though. I'm sure he's awesome, right? And the entire Crockwell family. But I notice here we mentioned that we're looking at going for a bit of an iPad donation drive. Teresa, what do we want to tell our listeners about that?
Yes, well, again, this happened because of we come across this together. We would be very grateful if anybody had any old iPads that they weren't using, to
If they've updated and stuff.
And
yeah.
they've updated them, and there's one sat in there, not too old because of the software.
Sure.
But they've updated that they. Oh, sorry, you go ahead because I've gone all tongue-tied.
So, like with iPads, there's so much opportunity with low vision.
Sure.
You can listen to your books now.
Sure.
You can get the
Yeah.
you can get the electronic version.
Sure.
And you can zoom in to see the text bigger, or you can change the background,
For the contrast
the
and
contrast
stuff.
and the lighting. So sometimes people just need something bright to look at. Their old
To help them
Bible
read.
with the bad contrast
Sure.
isn't the best thing for them to read.
Sure.
And there's so much that they can download onto an iPad.
Absolutely.
Even there are apps available where you can take pictures and it will tell you exactly what you're looking at. And a lot of people unfortunately can't afford an iPad.
Sure. Sure.
And it's
What-
just the next step.
What from what number iPad are we looking in up for people to think about donating?
What are we even
I
on
would
now?
say, I'm not sure what we're on. So the equivalent to a 10, really, or
Okay.
an SE in an iPhone,
Yeah.
Okay.
so that the software will
Will-
upgrade
will-
for a
will
few
sync.
more years.
Maybe
Yes.
what year? That'd
Yeah.
probably be a better question. Like
Yeah,
maybe
that probably
2-3 years old at most.
Yeah,
most.
Sure.
Yeah,
Yeah.
maybe,
From
maybe 3-4. Maybe I have to
Yeah.
stretch it
yeah.
to 3-4. But yes, and then we can donate them to clients that will support, so they can continue reading.
Sure.
And the reason why we're sort of choosing iPad over Android is because the voiceover on iPad and iPhone, is just fantastic in what you can ask it to do. And you can do exactly the same with an iPad. So you can ask it to, send a message to Tia,
Sure.
and it will read out. It'll ask you then what do you want to say, and you say thank you so much for coming on the show. You were awesome.
And it'll send it to her, yeah.
And then it'll repeat it, and you say yes, send, and then it'll send it to Tia, and Tia could just respond to me by saying, because then when it goes to Tia, it would say, if she had voiceover on as well, it would ask, your message, repeat the message that I've just said. And do you want to send a message back? And
Gotcha.
It's just fantastic. Whereas Android's a bit more clinky. It's not quite
It
as
isn't finessed as well as
Yes.
as Apple has managed to
Yeah.
make the helpful parts of this. So I would also probably say that anyone with an iPhone
that's
from the
useful
10
too.
onwards, that because there's a couple
Yes.
places here where you can buy reconditioned ones. A couple of
Yeah.
the phone service places sell them. So we want our listeners to know that if you have someone in your life, and people say, oh, they'll never even try, but it's amazing how much it opens up for them. And if they realize that with just a few simple voice commands, they can have all this help
Yeah.
with their vision loss with a smartphone. So we want to encourage folks out there that are perhaps dealing with someone, might be older, who's a little frustrated. Just a demonstration from you guys about the simplicity of the help that you can get from
Yeah.
it would be good. And also the price points of reconditioned ones, because there are people who religiously update every year.
Yes,
You know what I
yeah,
mean?
there are.
And those who need it, that operate their, a lot of business off their phones and stuff, it's necessary. But we're just looking for it to be helpful for those with low vision.
There's only one potential hiccup with the iPad, and that is that if you're wanting to download books, you generally need an Amazon account.
You need an account.
So it needs somebody, and what does happen with our older generation is that their daughter might have an Amazon account
Yeah.
and then put the books on their mum's iPad,
Sure.
or their aunt's iPad. That works very well.
Sure.
But that's the only potential hiccup. So it's not the perfect choice. You know, it's not like oh, you can get an iPad and now I can start reading my books.
Sure.
Because you have to have an outlet of being able to get the
being able to get the
them.
e-books.
But then there's the library, actually.
Exactly.
Nearly forgot about the library. The library's books that you can download, and they're talking books too.
Yes.
You just go along to join the local library.
Join the local library, yes.
And you
we
get
like to encourage that to anyone, even without vision loss. Join it and
exactly.
see just, you know, a lot of people like to listen to audiobooks anyway, right?
So there's that as well, actually, which I've
They
nearly
can
forgotten
read
about.
the newspaper on their iPad.
Sure,
That's a big
The
part of
emails.
people's lives.
Yeah, knowing what the paper
yeah.
says every day.
Yeah.
It's
And to-
interesting, isn't it? The newspaper is probably the top thing that people say to me that they're sad they can't read now.
Sure,
Yeah,
that they can't read.
Our paper isn't great.
And the fine print.
Yeah.
And even the I know there are apps that look at it for you and tell you what it
Yes,
says just
there
by
are.
using the phone camera.
Yeah,
It'll
and I
read
can
it
help
back
with
to
that.
you. And Teresa can teach you how to do that. So
Yes.
as far as OnSight, which is just awesome, OnSight Optometry, what's the best way for folks to get a hold of you, Tia?
So we have a website, onsightbda.com.
There you go. Mm-hmm.
Or you can call 732-5891 to book an appointment.
Right. And she will get in her trusty little car and come to you.
Yes, I will.
That is awesome.
I can do your whole family at one time.
Yeah, that's another thing I would think for maybe mothers that with several kids, that might be a wonderful option than trying to
Definitely.
traipse them all
Yep.
into town somewhere, right? We love our kids, don't we? So we're just thrilled that our new time here for Vision Talk on the second Monday of the month is at 5:15, and this program will be repeated on our sister station tomorrow night at 5:15. So that's the second Tuesday of the month on Power 95. Ladies, Teresa, anything you want to say before we go? But we've done our 30 minutes, love.
Yeah, well, no, just thank you everybody for listening, and welcome to our new listeners, and please
Yep.
tune in next month.
Absolutely, and you can always contact.
Thank you so much.
Thanks for
Yes,
coming,
thank
Tia.
you so much, Tia, for
Tia's
coming.
been brilliant.
No problem. Thank you for having me.
You can contact Vision Bermuda at 292-3231 or email info@visionbermuda.bm, and they would love for you to check them out on Facebook and like the page. And if you have a minute, do a review, because of course everybody always wants to know that they're getting the right information out there. We do appreciate you guys coming by today, Tia. Congrats. Keep doing what you're doing.
Thank you so much.
Thank you for taking care of our eyesight, folks. It's no joke. Make sure you get that annual checkup at least every year, right? Along with your GP setup. Thank you, ladies, for coming by.
Thank you.
Thank you.
Thank you.
Cheers. You've been listening to Vision Bermuda here on Ocean 89.